Hello, everybody. This is Alauddallah speaking. In this upcoming slide, we will talk about aminoglycoside and spectinomycin antibiotics. Aminoglycoside and spectinomycin are bactericidal inhibitor of protein synthesis that interfere with the ribosomal functions. These agents are useful mainly against aerobic gram-negative microorganisms. Firstly, we'll talk about aminoglycoside, which include, for example, streptomycin, neomycin, kanamycin, amikacin, and gentamicin, topiramycin. They are used in combination with other agents to treat a drug-resistant organism. For example, they are used with a beta-lactam antibiotic in serious infection with gram-negative bacteria. Number 2, used with a beta-lactam antibiotic oral vancomycin for gram-positive endocarditis, and with one or more agent for treatment of mycobacterial infections such as tuberculosis. All aminoglycoside, all of them are water soluble, stable in a solution, and more active at alkaline than an acidic pH. This is the structure of streptomycin. Streptomycin composed of three moieties. Number 1, which is in the left, is streptotidine. In the middle is streptose sugar. Number 3 is N-methyl glucosamine. Both of them, the sugar and the right is the structure N-methyl glucosamine in the right. Both of them are called streptosamine. Mechanism of action: aminoglycoside, irreversible inhibitor of a protein synthesis, but the precise mechanism for bactericidal activity is unclear. The initial level is passive diffusion of an aminoglycoside via porine channels across the outer membrane of a bacteria. Then the drug is then actively transported across a cell membrane into the cytoplasm by an oxygen-dependent process. The transmembrane electrochemical gradient supplies the energy for this process, and transport is coupled to a proton pump. So, low extracellular pH, and anaerobic condition inhibit a transportation by reducing a gradient. Transportation of an aminoglycoside can be enhanced by cell wall active drugs such as البنسلين أو الفانكومايسين. عشان كده بنديها تعمل لنا synergistic effect. This enhancement may be the basis of the synergism of those antibiotic with an aminoglycoside. بعد ما تخش البكتيريا inside the cell, aminoglycoside bind to various subunit ribosomal protein. Then the protein synthesis is inhibited by an aminoglycoside in at least 3 ways. Way number 1, interference with the initiation complex of peptide formation. Number 2, misreading of a messenger RNA, which causes incorporation of incorrect amino acid into the peptide and result in non-functional protein. Number 3, breakup of polysomes into non-functional monosomes. These activities occur more or less simultaneously, and the overall effect is irreversible and lead to cell death. They are resistant can be occurred by 3 principal mechanisms. Number 1, production of transferase enzyme that inactivate an aminoglycoside by adenylation or acetylation or phosphorylation. This is the principal type of resistance encountered clinically. Number 2, there is impaired entry of an aminoglycoside in the cell. This may result from a mutation or a deletion of a porine protein involved in the transport. Number 3, a receptor protein filtrase ribosomal subunit may be deleted or altered as a result of a mutation. When we came to pharmacokinetic and once daily dosing profile of an aminoglycoside are absorbed very poorly from an intact GIT, and almost the entire oral dose is excreted in feces after oral administration. Aminoglycosides so are administered intravenously at a 30 to 60 minutes infusion. When we give aminoglycoside intramuscularly, aminoglycosides are well absorbed, giving peak concentration blood within 30 to 90 minutes. After a brief distribution phase, peak serum concentration are identical to those following intravenous injection. The normal half-life of aminoglycoside in serum is 2 to 3 hours, increasing to 24 to 48 hours in patients with significant impairment of a renal function. Aminoglycosides are only partially and irregularly removed by hemodialysis. For example, 40 to 60% for gentamicin, and even less effectively by peritoneal dialysis. Aminoglycosides are highly polar compounds that do not enter cells readily. Intrathecal or intraventricular infection is required for high level in a cerebrospinal fluid. Aminoglycosides have been administered in 2 or 3 equally divided doses per day, patient with a normal function test. However, administration of the entire daily dose in a single injection may be preferred in many clinical situations for at least 2 reasons. Reason number 1, aminoglycoside exhibit concentration dependent killing. That is to say, higher concentration kill a larger proportion of bacteria and kill at a more rapid rate. They also, number 2, have significant post-antibiotic effect such that antibacterial activity persists beyond the time during which measurable drug is present. The post-antibiotic effect of aminoglycoside can last for several hours after administration of the dose. When administered with a cell wall active antibiotic, beta-lactam or vancomycin, aminoglycoside exhibit synergistic killing against certain bacteria. This synergy may be important in certain clinical situations such as endocarditis. Adverse effects of aminoglycoside are both time and concentration dependent. When we came to the adverse effect of an aminoglycoside, all aminoglycosides are ototoxic and nephrotoxic. Ototoxicity and nephrotoxicity are more likely to be encountered when therapy is continued for more than 5 days, but in higher doses, especially in an elderly and in the setting of renal insufficiency patients. Concurrent use of an aminoglycoside with loop diuretics, furosemide, hyaluronic acid, or other nephrotoxic antimicrobial agents, for example vancomycin or amphotericin, can potentiate a nephrotoxicity and should be avoided if possible. Ototoxicity can manifest either as auditory damage resulting in tinnitus and high frequency hearing loss initially, or as a vestibular damage with vertigo, ataxia, and loss of balance. Nephrotoxicity results in rising serum creatinine level or reduced creatinine clearance. Neomycin, kanamycin, and amikacin are the agents most likely to cause auditory damage. Streptomycin, gentamicin are most vestibulotoxic. Neomycin, tobramycin, gentamicin are the most nephrotoxic. In very high doses, aminoglycoside can produce Courier-like effect with a neuromuscular blockage that result in respiratory paralysis. Courier هنا جاي من الديتيوبيكرين. This paralysis is usually reversible by calcium gluconate when given promptly, or with reversible when we give neostigmine, which is acetylcholine esterase inhibitor. Hypersensitivity can occur frequently. Clinical use of aminoglycoside are mostly used against aerobic gram-negative bacteria, especially when there is concern for drug-resistant pathogens or in critically ill patients. They are almost always used in combination with beta-lactam antibiotic to extend an empiric coverage and to take advantage of the potential synergism between these two classes of drugs. empiric معناه انه ندي الانتيبيوتكس ده عشان تغطي لنا اللي هو كل انواع البكتيريا بدون ما نعمل اللي هو culture sensitivity test. penicillin aminoglycoside combination used to achieve cidal activity in treatment of enterococcal endocarditis and to shorten the duration of therapy for virulent streptococcal endocarditis. Due to toxicity, these combinations are used less frequently when alternate regimens are available. For example, in case of enterococcal endocarditis, studies suggest that the combination of ampicillin ceftriaxone is an effective regimen with less risk of nephrotoxicity. أول example للأمينوغلايكوسايد هو streptomycin. Streptomycin isolated from a strain called Streptomyces criceus, used for a mycobacterial infection as second line agent for the treatment of a tuberculosis, intramuscularly or intravenously, but in combination, used in non-tuberculous infections, for example in plague, tularemia, sometimes brucellosis. Streptomycin given 1 gram twice daily or 15 milligram per kilogram twice daily for children, given IM in combination with an oral tetracycline. Penicillin plus streptomycin effective for enterococcal endocarditis. The second one is gentamicin, mainly used in severe infection caused by gram-negative bacteria that are likely to be resistant to other drugs, especially Pseudomonas aeruginosa, Pteropacter species, Serratia maricinis, Proteus species, Acintopacter species, Klebsiella species. Gentamicin used in combination with a second agent because an aminoglycoside alone may not be effective for infection outside the urinary tract. Gentamicin in combination, soluble active antibiotic, indicated for the treatment of endocarditis caused by gram-positive bacteria, for example streptococci, staphylococci, and enterococci. Topical and ocular administration, creams, ointments, and solution containing 0.1 to 0.3% of gentamicin sulfate, used for the treatment of infected burns, wounds, skin lesions, and in attempt to prevent intravenous catheter infections. Meningitis caused by gram-negative bacteria has been treated by intrathecal injection of gentamicin sulfate 1 to 10 milligram per day. The third one is amikacin. Amikacin هو semi-synthetic derivative للكاناميسين, less toxic than الكاناميسين. It is resistant to many enzymes that inactivate الجنتاميسين والتبراميسين. بالتالي can be used against some microorganisms resistant to الجنتاميسين والتبراميسين. Many gram-negative bacteria, including Proteus, Pseudomonas, Pteropacter, Serratia, are inhibited by 1 to 20 microgram per milliliter amikacin in vitro. Amikacin is nephrotoxic and ototoxic, particularly for the auditory portion of the 8 nerves. The fourth is neomycin, kanamycin, paramycin. All of them have pharmacological properties same. Neomycin limited for topical and oral use due to toxicity associated with parenteral and higher resistance rates compared to other aminoglycoside. Kanamycin is limited to treatment of multi-drug resistant tuberculosis, although alternate agents such as amikacin may be preferred. Varenicline, effective against visceral leishmaniasis when given parenterally. Varenicline can be used for intestinal Entamoeba histolytica infection and intestinal infection with other parasites. Spectinomycin, the second group after aminoglycoside is the spectinomycin. Spectinomycin is aminocyclitol antibiotic. Structurally هو بيشبه الامينوغلايكوسايد but lack الامينو sugar anaglycosidic bonds. يعني اختلافه من الامينو جلايكوسايد انه ما عنده الامينو sugars ما عنده glycosidic bonds. Active against gram positive and gram negative organism, but it is almost as an alternative treatment for drug resistant gonorrhea or gonorrhea in penicillin allergic patients. Nephrotoxicity and anemia have been observed as a side effect to spectinomycin. Thank you very much for your attention.